brown pigment stone occurs because of what? It occurs because of the precipitation of the unconjugated bilirubin along with the calcium. Basically, what are the two types of gallstones that you know? We have pigment stones and cholesterol stones, two kinds. Commonly it is cholesterol stones, but those who have hemoglobinopathies, hemolytic disorders, in those people there is a more bilirubin release and they get bilirubinate stones, and that they are basically called the brown pigment stones is what you need to appreciate. And what type of infections may brown pigment stones are more common? In the case of the gram-negative infections, because gram-negative bacteria will release that enzyme which is required for the deconjugation of that conjugated bilirubin and lead to development of the brown pigment stones is what you need to appreciate. Then what is the epithelium of palatine tonsil? It's a very easy question. Stratified squamous epithelium. So this is a classical example of the crypts, and the stratified squamous epithelium is what you need to understand. Then doctor, which cranial nerve is very closely related to the hyoid bone? Hypoglossal nerve. Hypoglossal nerve typically passes down, and this is the point where you have the hyoid bone, and that is the area where hypoglossal ultimately supplies the motor supply to the tongue is what you need to understand. Regarding the IUCD, one question on contraception definitely will come. So, can you use it as a postcoital contraceptive? We can use. What are the two regimes which are available for postcoital contraception? You can take one OCP within 12 hours duration, 2 doses, one method. Then one more method is you can also place an IUCD, copper bearing IUCD is another method by which you can achieve postcoital contraception as an emergency contraception. Then this is another very favorite question. If you happen to apply mafenide acetate, then that leads to development of metabolic acidosis on the burns. Now why mafenide acetate application will lead to? Mafenide acetate is an inhibitor of carbonic anhydrase. What is the normal function of carbonic anhydrase? बोलो डॉक्टर. Carbonic anhydrase क्या करता है? In the level of the renal tubule, you have the proximal renal tubule. Here you have a carbonic anhydrase enzyme. So it will combine CO2 plus H2O and produce carbonic acid that will be broken down into bicarbonate, and it will lead to the reabsorption of this bicarbonate from here in the proximal tubular cell. अगर कार्बोनिक एनहाइड्रेस का इनिबिशन हो गए तो बाइकार्बोनेट का रीअब्जॉर्प्शन नहीं होता, अगर नहीं हुए तो ट्यूबुलर फ्लूइड में वो चले जाता, अगर वो चले गए तो एसिडोसिस आता है या अल्कलोसिस? Acidosis. So there is a reason all carbonic anhydrase inhibitors have an attendant complication of developing metabolic acidosis, and mafenide acetate is classically known to lead to development of metabolic acidosis is what you have to basically remember. Then doctor, what is the normal intravesical pressure during voiding? Already your bladder is full in the exam hall. On the top of it, examiner is playing jokes on you. कितना प्रेशर होगा आपको इस वक्त में? तो basically micturating cystourethropy, and beyond an age, what is the main challenge, doctor? Especially women patients, incontinence, urge incontinence, stress incontinence. Tomorrow some of you are going to be top urologists. So assessment of the bladder pressure, intravesical pressure, similarly pediatric population में reflux uropathy is very common. So intravesical bladder pressure measurements is a very common thing in urology. But knowing the exact value is too much of an expectation. किसके हाथ में है? भगवान के हाथ में है. If you didn't answer, leave it to God. 35 to 50 centimeters water is what you need to remember. Where do you see pathological fractures? In case of Paget's disease, we see the pathological fractures. देन वो ऑसिफिकेशन सेंटर अगर दिखाई दिए तो आप फॉरेंसिक मेडिसिन में द फीटस वाज वायबल बोल के बोल सकते हैं. व्हाट इज योर गेस? गिव मी वन आंसर डॉक्टर. ऑनलाइन क्लास स्टूडेंट्स, Emma, Gaurav, Rupam, Rachita, everybody, what is your answer? Let me check your guess. Huh? Common sense answer clavicle हो गया ना? Clavicle एक आंसर आ गया. Preeti, Gaurav are saying clavicle. हाँ, और? हाँ? Rupam says clavicle, Shazia says clavicle. मगर एक टॉपर पैदा होगा. ओनली द टॉपर विल गिव द करेक्ट आंसर. बताओ, और एक चांस ले लो. सी डॉक्टर, अगर कॉमन सेंस के साथ आप एग्जाम में गेस मार के पास हो जाएंगे बोल के ख्वाब देख रहे तो होना है, कुछ गेसिंग तो होना है. मगर 200 मार्क्स में 20 मार्क्स मिलेगा. बट वो 20 मार्क्स से सीट नहीं मिलेगा. रूपम, तिरुपति, गौरव, प्रीति, अनु, गयु, देर ऑल सेइंग कैल्केनियस. चलो फुट को चले गया. क्लैविकल. और एक गेस मारो. मामा जी मुझे 4 चाहिए. कम ऑन, गिव मी द आंसर. 4 आंसर्स. Emma is saying talus, but slowly telling. So we don't agree. So that please give one big clap to Emma. Loud clap, loud clap. Now Shazia is recommitting to talus. Don't forget. Talus. इसके लिए कुछ इंटेलिजेंस का जरूरत है क्या? नहीं है. Luckily, if you read this, you will answer. You didn't read it, chalo. But clavicle is a good guess. Don't kill your guessing skills. Right? Maybe your guessing can go wrong, but to guess clavicle is the reasonable guess. That is important. Okay? So, at the end of 7th month, the talus will appear, and appearance of the talus center of ossification is the evidence of legal viability, is what you have to basically remember. Now Fanconi syndrome में rickets होता. Fanconi क्या होता? Proximal renal tubular dysfunction. Fanconi syndrome में vitamin D deficiency होता. अरे, it was like a perfect foot in the pond kind of a question. Okay? वहां रिकेट्स है, यहां विटामिन डी है. इमीडिएटली हाइपोथैलेमस बोलेगा थैलेमस को, सेरेब्रल कॉर्टेक्स को बताओ मां, आंसर लगाओ. एजर्शन राइट, रीजन राइट. मगर एग्जामिनर का ट्रिकी क्वेश्चन है ये. रिकेट्स होता मगर वो विटामिन डी डेफिशिएंसी की वजह से नहीं होता. फैंकोनी में क्या होता? प्रॉक्सिमल रीनल ट्यूबुलर डिस्फंक्शन के वजह से प्रॉक्सिमल रीनल ट्यूबुलर एसिडोसिस, प्रॉक्सिमल रीनल ट्यूबुलर डिस्फंक्शन के वजह से एमाइनो एसिड्यूरिया, बाइकार्बेटिन्यूरिया, फॉस्फेट्यूरिया, ये सबका रीअब्जॉर्प्शन प्रॉक्सिमल ट्यूब्यूल में होता. फैंकोनी में यहां दिक्कत है, उसके वजह से ये सब यूरिन में निकल जाता. So because of that low phosphate levels, whenever phosphate levels is low, that lead to development of rickettsial changes in the bone. क्योंकि mineralization नहीं होता properly. That is the reason for the rickets, not vitamin D deficiency. Beautiful question, super question. So let's go to the next question. Assertion is true but reason is false. So in spite of normal vitamin D, normal calcium, because of the low phosphate and loss of phosphate into urine, there is a development of rickets in the case of the Fanconi, is what you need to remember. आम्सलर का ग्रिड कहां इस्तेमाल करते? टिपिकली टू नो द सेंट्रल पाथ ऑफ द विजन, मैक्युलर डिस्फंक्शन को जांच करने के लिए आम्सलर ग्रिड का इस्तेमाल होता है. Which bacteria produce the spores? Anthrax spores, bacillus, right? So bacillus produces. Yes, son, all these questions you should answer. 100% correct answer karna. No second thoughts in the exam hall. Regarding the ITP, any splenomegaly or any lymphadenopathy is against the diagnosis of ITP. ITP को कब ITP बोलते हैं आप? इडियोपैथिक थ्रोम्बोसाइटोपेनिक परफिरा. किसी कॉज के वजह से थ्रोम्बोसाइटोपेनिया हो तो उसको इडियोपैथिक थ्रोम्बोसाइटोपेनिक नहीं बोलते. अगर स्प्लिनोमेगली है थ्रोम्बोसाइटोपेनिया हो सकता क्या? हो सकता. क्यों? इन स्प्लीन में डिस्ट्रक्शन हो जाता स्प्लिनोमेगली है तो. देन इज इट इडियोपैथिक? नो. तो इसलिए स्प्लिनोमेगली कभी नहीं होना. इट इज अगेंस्ट द डायग्नोसिस ऑफ आईटीपी. लिम्फेडेनोपैथी नहीं होना. अगर लिम्फेडेनोपैथी है तो वो लिम्फोमा है. अगर लिम्फोरेटिकुलर मैलिग्नेंसी है तो वो बोन मैरो के अंदर दिक्कत है. अगर बोन मैरो के अंदर दिक्कत है तो प्लेटलेट के प्रोडक्शन में दिक्कत होगा. अगर हुए तो थ्रोम्बोसाइटोपेनिया होगा. उसको इडियोपैथिक नहीं बोलते. तो नो स्प्लिनोमेगली, नो लिम्फेडेनोपैथी. एंड व्हाट टाइप ऑफ platelets the patient will show? Low platelets, normal sized. Suppose if the platelets are very tiny platelets, then what is the common diagnosis? There is an entity called X-linked thrombocytopenia or Wiskott-Aldrich syndrome. इसमें भी thrombocytopenia होता मगर वो platelets का size बहुत छोटा, small platelets will be there. That is Wiskott-Aldrich, not ITP. Okay, that's what examiner is interested about. वन एवास्कुलर नेक्रोसिस और एक ब्रिटिश वालों का नाम, हु इज श्रूमैन, हु इज किनबॉक, हु इज पेजेट. टोटली 7 or 8 लोकेशंस में आपको एवास्कुलर नेक्रोसिस होता, ऑस्टियोकॉन्ड्राइटिस होता. तो किनबॉक इज द प्रॉब्लम इन द लूनेट. एवास्कुलर नेक्रोसिस द लूनेट इज बेसिकली किनबॉक इज व्हाट नीड टू बी रिमेंबर्ड. BCG is produced from the Mycobacterium bovis. Then what is adiponectin? Inflammation is a high yielding topic, but this adiponectin in inflammation is a rare thing. If a question comes on interleukins, TNF alpha, beta, they are all expected. But what is adiponectin? Adiponectin regulates the glucose levels as well as fatty acid breakdown. It is produced by the adipose tissue, and the level of this hormone is inversely correlated with the body fat percentage in the adults. In fact, adiponectin has got a pleiotropic effects. Lot of effects are there for adiponectin. But if you look at the high yield topic list, Dr. Giherlin or Gerlin, what you call, then adiponectin, once more in the obesity pathophysiology, lot of questions are asked. So that is the reason that way becomes a high yield area. Then is post-operative wound dehiscence, doctor, 5th to 8th day post-operatively. So what is the time required for serum beta HCG to normalize after a molar pregnancy, doctor? It takes around 7 to 9 weeks. And a very very standard question. 2 महीने आप फॉलो अप करना पड़ता मोलर प्रेगनेंसी के बाद अगर बीटा HCG नॉर्मलाइज हुआ या नहीं. अगर नहीं हुए तो द ट्रोफोब्लास्टिक डिजीज इज नॉट वेल कंट्रोल्ड. सो यू हैव टू लुक फॉर एनी रिकरेंस और रिलैप्स ऑफ द अंडरलाइंग मोलर प्रेगनेंसी इज व्हाट यू नीड टू अंडरस्टैंड. Ophthalmoplegia, nystagmus, ataxia, etc. They are all the features of Wernicke's. Encephalopathy and typically Tucker whenever thiamine deficiency is there in a chronic alcoholic. Another very standard question. Then Burley's ulcer. Burley's ulcer doesn't undergo malignant transformation, but Burley's ulcer basically requires a surgical treatment is a true statement. So Burley is caused by Mycobacterium ulcerans and it requires surgical treatment, but it does not become malignant is what you need to understand. A 40-year-old with acute onset of the low back pain. In this country, disc prolapse is the favorite question of the examiner. Depending on the level of the compression, L4, L5, L5, S1, L3, L4, how will be the reflexes, muscle weakness, sensory disturbance? You have to localize the lesion. Is a very, very important question. So, doctor, all this, that is extensor hallucis longus, dorsiflexor, sensory loss on the dorsum of the foot, lateral side and a brisk knee jerk, they are all suggestive of a L4, L5 disc prolapse with the L5 nerve root compression is what you need to basically remember. See doctor, L4 yahan hai, L5 yahan hai. So you have the L5 root coming like this, and there are two types of disc prolapse. One is called as lateral herniation, other is called as central or paradiscal herniation. Central herniation like this is more common, central and paracentral, and a compression of the central or disc prolapse हो गया डॉक्टर, अगर वो हो गया तो L4 को कंप्रेस कर सकता, L5 को भी कर सकता. अगर वो पैरासेंट्रल है तो L5 को करेगा, अगर वो सेंट्रल है तो लैटरल है तो L4 को करेगा. ये दोनों के बीच में which is more common? Paracentral is more common than lateral. So there is a reason L4, L5 compression, paracentral will compress which nerve root? L5. L5, S1 will cause compression of S1. L3, L4 will cause compression of L4. Now the next question. L3, L4 का herniation paracentrally हो गए तो who is compressed? L4 will be affected. L4, L5 will cause L5. L5, S1 will cause S1 is what you need to understand. Now, one of the favorite question, L5 root compression hai to what are the features? The sensation on the lateral side of the leg and the dorsum of the foot is lost. Then the extensor hallucis longus and the foot dorsiflexors. Dorsiflexion, plantiflexion. दो तरह के होते ना, तो dorsiflexors become very weak. The patient cannot lift the foot up. Dorsiflexors are weak. Okay. Then what else? आपके L5 के नीचे होता है S1. S1 के वजह से होता है ankle jerk. S1 is not affected. L5 compression हो गया तो ankle jerk won't be affected. Right? So this is what you need to appreciate. Then if L5 S1 हो गया तो S1 root actually ankle jerk can become exaggerated, क्योंकि if the above root is compressed, below things will become UMN type. इसलिए L5 compression हो गया तो S1 क्या होना? Exaggerate होना. तो actually ankle jerk will not be normal, rather ankle jerk will become exaggerated. Then doctor, अगर L5 S1 के बीच में herniation हो गया तो S1 का compression हो गया. S1 will go and supply the ankle jerk. So ankle jerk become ariflexic. And sensory loss is along the lateral side of the foot. Lateral side of the foot आप गए तो क्या मिल गया आपको? Little toe or big toe? Little toe. Little toe is hence supplied by S1. Whereas the if you go on the dorsum of the foot, what will you touch? Big toe. इसलिए big toe is supplied by L5. 5 और 1 में which is big number? 5. इसलिए remember L5 is big toe and dorsum of foot. S1 is 1 is small number. That's the reason sensory supply is to the little toe. So that is what you need to basically appreciate. Okay, doctor. So summarize. You can put off those lights so that they will go away. Even those two lights. So L3, L4 disc herniation cause L4 root compression. Sensory loss is along the great toe and the medial side of the leg. Big toe medial में होता, lateral में होता, middle में होता, medial side of the leg. Motor loss will be the extensors of the knee, and the knee jerk becomes sluggish or absent in L3, L4. Similarly, L4, L5, then L5, S1. I leave the literature for you. Okay, doctor? Then, what are Balthazar criteria? This was recently asked in JIPMER or AIMS exam recently. So, it is for acute pancreatitis. Ranson's criteria था pancreatitis में वो examiner bore हो गया पूछ के. Glasgow भी था वो भी bore हो गया. Apache भी था वो भी bore हो गया. अभी नया criteria आ रहे वो है Balthazar CT severity index radiologically. So you will look whether there is an enlargement or necrosis, कितना necrosis है, pancreas के आजू बाजू में fluid है क्या, ये सब देख के severity of the pancreatitis को decide करते हैं. उसका index होता है Balthazar severity index, CT severity index in acute pancreatitis is what you need to remember. Steroid stones occur in alkaline urine. And whenever infection with Proteus mirabilis is there, then it will split the urea and lead to alkaline urine, as all of you know. तो आपको एक डायग्राम दिया गया सोडियम पोटेशियम का ट्रांसपोर्टर, and you are asked what is that which is number 4 in this. Actually the number 4 in this is phosphorylation site. This is the site where phosphorylation occur, and ATP become broken down, and that gives energy for the sodium potassium antiport is what you have to basically understand. The binding site for ATP will be these two arms, and the sodium and potassium become transported. Now there is hypertension, hypercholesterolemia, angina, constipation. Then which medication can lead to constipation? Constipation is commonly a side effect of calcium channel blocker, like verapamil is what need to remember. Then in bladder carcinoma, it is the intravesical BCG, which will help to reduce the risk of tumor progression is what you need to understand. What is meant by Tourette syndrome? Tourette is basically what? Multiple tics. Patients will start giving obscene words. What is it called? Coprolalia can be part of the tics of the patient. So it is more common in the boys rather than in the girls. Vocal tics and multiple motor tics will be there, and patient will have coprolalia as a characteristic feature is what you need to understand. Now let us talk about the Hill-Sachs and Bankert. What is the difference between the two? Stripped along the anterior margin of the glenoid rim become Bankert, and the posterior lateral aspect, the indentation is called Hill-Sachs. So what is this, doctor? Hill-Sachs. Posterior part, there is an indentation ना? जब dislocation हुआ, इसको क्या बोलते हैं? Hill-Sachs. And the other one is Bankert. You can easily to remember. Hill होता ना, hill के ऊपर, Hill-Sachs. इसलिए it will be posterior superior in location. That's a way to remember. Then stellate ganglion block where you won't have mydriasis, rather you have meiosis. Stellate किसका ganglion है? Sympathetic या parasympathetic का? Sympathetic ganglion है. इसलिए you will have normally sympathetic pupillary dilatation. Horners में क्या होता? Sympathetic block की वजह से meiosis होता, mydriasis नहीं होता. Then what is selective progesterone receptor modulator? If you take tamoxifen, raloxifene, etc., what are they called? Serums. Selective estrogen receptor modulator. Mother vulpristol is called a selective progesterone receptor modulator. It is also called Ella in US. Ella is used as a contraceptive, and it is a selective progesterone receptor modulator is what you need to basically understand. Then doctor, visually evoked response, where will it get affected? What is visual evoked response? Given the board. You have the retina on which the light is falling. From the retina comes the optic nerve. So the electrical signals are passing through the optic nerve whenever you are visually seeing something, and they are recorded by a voltmeter, and whatever the voltages you get are called as visual are basically recorded. Now if you have a demyelinating process or any inflammation leading to the damage to the optic nerve, the conduction velocity of these visual evoked potentials become delayed, and that will reflect in your recording. Can you tell me one of the very common causes for the development of the optic neuritis? Multiple sclerosis, demyelinating disorder. There the visual evoked potentials become delayed, is what you have to basically understand. Okay, doctor? Now, 25-year-old patient presents tenderness in the low dorsal back and MRI is shown. What do you see here? Around the vertebra there is a paravertebral fusiform abscess is there. What is the common cause in this country? What is our rule? अगर TB options में है तो आंसर क्या होगा? TB ही होगा और कुछ भी नहीं होगा. That is called India. So tuberculosis of the spine is the answer. Common dictum. Any entrance you go. Then mammography में what is the correct statement? Basically there is no risk of malignancy and the dose of radiation is very low. And what kind of voltage you have? You have a low voltage, high amperage. X-rays are the part of the mammography. 40 kilovolts is exposed along with 300 milliamperes is what you need to remember. Then what causes swimming pool granuloma? Mycobacterium marinum. देखो एग्जामिनर को कितना प्यार है माइकोबैक्टीरियम के ऊपर. एक बुरुली सल्सर आ गया वहां, उसके बाद एक स्विमिंग पूल ग्रैन्युलोमा भी आ गया. तो इसलिए माइकोबैक्टीरियम क्लासिफिकेशन एवरीथिंग इन द अनंत नारायण microbiology or any microbiology book you have to read. So this is the classical example of a swimming pool granuloma. Mycobacterium ulcerans is what you need, marinum is what you need to remember. Then about fluorosis, what is the important thing? You don't have osteoporosis in fluorosis. You have a increased density of the bone. Fluorosis may, you don't get glass-like vertebrae, you get chalky white vertebrae. So porosis is not the rule. Then axial skeleton, spine में ज़्यादा changes होता है instead of appendicular skeleton. In case of fluorosis is what you need to basically remember. The nerve which supplies the angle of the mandible is which one? Entire face is trigeminal, skin supply, sensory supply, except the only area which is not supplied by trigeminal but great auricular nerve is the skin overlying the angle of the mandible. Okay? Entire face motor supplies by the facial nerve, except the levator palpebrae superioris that lifts the eyelid, which is supplied by oculomotor nerve, is what you have to basically remember. Now doctor, Naegler's reaction typically will be testing lecithinase enzyme in case of the Clostridium perfringens. Naegler's reaction, lecithinase activity is what you should not forget. So Clostridium perfringens, how will you recognize? Catalase negative, indole positive, lecithinase positive, lipase negative, litmus milk stormy fermentation. So they are all the important properties. At least 10 bacteria and their culture characteristics आपके टिप्स में रहना. Streptococcus, Staphylococcus, Haemophilus influenzae, E. coli, Vibrio cholera, Gonococcus, meningococcus, among Neisseria and the Clostridia. 10 ऑर्गेनिजम्स का 5 to 6 कैरेक्टर्स होता है, कल्चर कैरेक्टरिस्टिक्स, अंटिल एंट्रेंस एग्जाम. एंट्रेंस के बाद भूल जाओ. गिव योरसेल्फ टू वन इलेक्ट्रोकन्वल्सिव थेरेपी, फिनिश ऑल एंट्रेंस मैटर इज आउट, फ्रेशली यू कैन गो एज अ पोस्ट ग्रेजुएट. ठीक है, बट तब तक तो आपके टिप्स में रहना ही पड़ेगा. रन अमॉक इज द फीचर ऑफ कैनाबिस, अनदर बिस्किट क्वेश्चन. 5 क्वेश्चंस बिस्किट्स हो गया. Then a fallen fragment within the lytic bone, as what you can see here. A fallen bone fragment के जैसे दिखाई दे रहे हैं ना, तो where do you see? Typically you will see it in the case of the bone cyst. Simple bone cyst, which is not aneurysmal, but simple bone cyst, it is an important feature. Binding of amino acyl tRNA कहां होता है tRNA के अंदर? डीएनए, आरएनए, स्पेशली टीआरएनए, एमआरएनए, आरआरएनए. आरएनए के स्ट्रक्चर के ऊपर एक क्वेश्चन आता है. व्हिच इज द टाइनीएस्ट आरएनए ऑफ ऑल? टीआरएनए. व्हाट इज द मैसिव आरएनए, लार्जेस्ट आरएनए ऑफ ऑल? एमआरएनए. देन these are some of the basics. Now doctor, टी ओमेगा सी लूप होता ना यहां, इसके एंड के ऊपर नया शादी होके अमीनो एसिड आ जाता ना, वो आके पहला वहां रेंट के किराए के लिए रहता. राइट? सो टी ओमेगा सी इज द पॉइंट वेयर न्यू अराइविंग अमीनो एसिड ग्रुप विल कम एंड अटैच, इज व्हाट यू नीड टू रिमेंबर. Sydenham's chorea. Basically it occurs both in rest and also during action. मगर नींद में यू वोंट हैव कोरिया. अगर नींद में भी कोरिया है तो दैट इज एपिलेप्टिक फिट रादर देन कोरिया. राइट? सो यू मस्ट नो कैरेक्टरिस्टिक्स ऑफ द कोरिया. टेल मी अबाउट कोरिया इन रोमैटिक फीवर. व्हाट इज द रेयरेस्ट ऑफ ऑल जोन्स क्राइटेरिया इन रोमैटिक फीवर डॉक्टर? कोरिया. व्हाट इज द मोस्ट स्पेसिफिक ऑफ ऑल द मैनिफेस्टेशंस ऑफ रोमैटिक फीवर? वंस मोर कोरिया. एंड विच वन क्राइटेरिया अगर है और कुछ भी नहीं है फिर भी आप रोमैटिक फीवर का डायग्नोसिस कर सकते हैं. और क्राइटेरिया कोरिया. कोरिया का दिस 3 थिंग्स यू शुड नॉट फॉरगेट. वो सब निकल जाने के बाद खाली कोरिया आता. कोरिया इज ए लेट मैनिफेस्टेशन, इसलिए खाली कोरिया है तो भी आप रोमैटिक फीवर का डायग्नोसिस कर सकते हैं. दैट इज इंपॉर्टेंट. ए यंग पेशेंट हैज इन्वेसिव सर्वाइकल कैंसर, you want to surgically manage him. Why do you prefer surgery over radiotherapy? Young है इसलिए ovaries का जरूरत है. Young है they need to have sexual activity. You can't stenose the vagina by your ridiculous radiotherapy. After all, what the patient got is only a cervical cancer. Then post radiotherapy pyometra is complication. Post radiotherapy pyometra, collection of pus into the surrounding adnexal structures is common. That can be avoided. That is the reason you prefer surgery over that of the radiotherapy, is what need to be remembered. What is the anti-craving agent? Acamprosate, fomepizole, acamprosate, disulfiram. What is their mechanism? पूरा शराब के बारे में जो भी चीजें हैं, एक शराबी क्वेश्चन तो जरूर आएगा, क्योंकि हम भारत में हैं जहां देवदास पैदा हुआ. विदाउट अल्कोहल क्वेश्चन, वन और अदर फॉर्म, फॉरेंसिक में भी आता है, फार्माकोलॉजी में भी आता है, यू हैव टू रीड, साइकियाट्री में भी आता है. तो acamprosate is the one which will decrease the craving, is what you need to remember. What will it do? It will stabilize the chemical balance in the brain. All our personality is little chemicals in the brain, doctor. थोड़ा डोपामिन कम हो गए तो डिप्रेशन आता, डोपामिन ज्यादा हो गए तो डांस करना शुरू करके, और ज्यादा हो गए तो साइकोसिस शुरू होके, और ज्यादा शुरू हो गए तो एक चाकू लेके सबको काटते हुए जाते आप. पूरे डोपामिन के हाथों में है हमारा जिंदगी का प्लेजर. देन which is not a feature of Beck's triad. दे तो बिस्किट क्वेश्चन है. Cardiac tamponade में heart is constricted, it can't fill with blood at all. If it is not filled, where will it pump? If it can't pump, how will you have hypertension? You will have hypotension, which is the feature of cardiac tamponade. Codman's triangle, basically it is because of the new bone formation. You get the Codman's triangle in case of the osteogenic sarcoma, etc., etc. For the arterial supply to uterus, what is the pathway? Uterine become arcuate, become radial, become straight, become spiral. अगर straight के बाद spiral होता या spiral के बाद straight होता, will decide whether you will join DCH or MCH. If you do mistake here and there, बहुत फर्क हो जाता. अगर straight के बाद spiral बोल के आपको याद नहीं रहे तो spiral के बाद straight बोले तो instead of joining MS general surgery, you will join forensic medicine. मगर दोनों एक ही है ना, वहां भी काटते, यहां भी काटते, यहां मुर्दे को काटते, वहां जिंदगी जीने वालों को काटते. Right? But don't get justified in life like that. What is there? There it is living bodies we are cutting, here dead bodies we are cutting, anything is cutting only na. Anatomy is same as general surgery bole to, how will it be? So isliye, until exam, only one thing should appear to you. You being called on the counseling time. The next seat goes to 4th rank, 5th rank, 6th rank, followed by your name. Only that auditory hallucination and that dream, ख्वाब की visual hallucination, खाली वो दिखना है until the day of counseling, until the day of exam at least. Of course, if that continues after the exam also, that will have some psychiatric perturbations. So, bullseye maculopathy, where do you see? Typically we see it whenever there is any chloroquine toxicity. Whenever chloroquine toxicity is there, then the retinopathy will lead to this kind of an appearance which is looking like the eye of the bull, is what you need to basically remember. Which is not a feature of osteopoikilosis. Osteopoikilosis में, this is how the, इसको देखते ही आपको क्या डाउट आता है एक्सरे को देख के? It looks like secondaries. Exactly, वैसा ही दिखता है. Osteopoikilosis. But sclerotic bony islands, autosomal dominant inheritance, not X-linked inheritance. It is also called spotted bone disease, is the other name which is being given for it. Fine needle aspiration of thyroid nodule shows Samoma bodies. Samoma bodies, papillary carcinoma. Biscuit question है. कितने हो गया biscuits? 6 biscuits in the first 100 questions means another 4 biscuits in next 50. So 10 biscuits तो मिल गया, तो we'll take 5 minutes break.